All right. Welcome to the podcast. My guest today is my dear friend, Dr. Dan Meltzer. He's a board certified emergency physician. He's the former chief and chairman of the emergency department at Kaiser Permanente in San Diego. He's had many executive leadership roles as chief medical officers for several organizations and is currently the chief medical officer of clinical solutions for Matrix Medical Network. Dr. Dan, welcome, my friend. Awesome to have you on the podcast.
Hey, it's an honor, Jake. Great to be with you, buddy.
Yeah, man. I've gotten a chance to get to know you over the last couple of years. We're friends. I say that before we even get started here. We do spend some time together on a personal basis. I find you to be a very interesting person with a very calm and interesting perspective. Is one of the reasons I asked you to come on the podcast. Would love for you to share a little bit about yourself. Let's talk a little bit about what got you into medicine. I think a lot of the time that we'll spend today, let's talk about healthcare. It's an interesting thing that's going on in the world, but love to find out a little bit about you, what interested you in it, how that role's changed and evolved over time. So what's the genesis of Dan and your interest in medicine?
Well, it's funny. I mean, what we do is not necessarily who we are. But I think sometimes as a physician, just kind of unpacking the question, people say, Dan the doctor or, Dr. Meltzer. And for me, it's no different than, Jake the podcaster. Like, you're Jake. There's many facets to Jake. This is part of what you are, but it's not all of who you are.
Yeah.
And so for me, like, a physician is it's my vocation, but it's not necessarily my avocation. So I think that's the first clarifier I would throw out there. What we do is not who we are. And it's hard sometimes as certain professionals to unpack that and to get others to see the full person because there's a bias towards a very linear way of thinking. So that's my first ramble. There will be others. But to answer your questions, I got into medicine, I think like many people do, it's a factor of what we know, of the environments in which we're raised. It's somewhat by design, somewhat by default. My dad's a physician, candidly. So, it was a familiar profession to me, kind of by osmosis. I saw what he did, and I saw, the life and the lifestyle, the intellectual curiosity, the passion that he brought for patient care. He's a pediatric specialist and highly compassionate, highly scientific, highly engaged now for 50 years. And so I was like, that seems like a good kind of road to go down. I had the aptitude for it. I could do it. So between knowing it and the ability, gravity sort of pulls you there. I started in college pre-med because it kind of made sense. Although I took as much other stuff as I possibly could. And then interestingly, I finished college and I did have a moment of one of several, which is, actually, what do I really want to do? And much to my parents' dismay, I was an Ivy League graduate, now back at home living with them. And I don't think that's what they initially thought for.
This is not what we imagined, Dan.
But here I was, back at home, and I really wasn't sure what I wanted to do, even though I had this kind of pre-med background. I literally found a brochure sitting on my dad's desk one day for a healthcare consulting company. It was a couple of physicians that kind of went left when a lot of people went right. And this is, 25 years ago. We're thinking about how do we bridge the gap between clinicians over here, administrators over here, patients over here. And I found that really interesting. So much like you do, it takes a little chutzpah. I just picked up the phone and I called them and I said, hey, I'm Dan. I'm interested in what you're doing. And they said, well, come on in for an informational interview. And at the end of the informational interview, they said, well, why don't you just work for us? I said, okay. You grab the boots and jump. And that experience working with physicians, but really looking at healthcare as an industry, as a profession, but really as an industry, opened my eyes to, it's a fascinating industry, to your point where you started. And there's lots of ways to make a dent. And so a couple of things that I realized. Number one, there's a lot in college I didn't know. So I went back to school to learn some more. And when I was in graduate school in healthcare administration, there were a lot of clinicians and physicians in particular that were making an impact not only as doctors, but as leaders. And so I really felt like, okay, this is the vision I want to create for myself. So 25 years later, kind of here I am. I went to med school and residency, and I trained and I worked as a full-time physician for 15 years. And I can continue, but have lots of zigs when others have zagged. I left a very stable organization when most people don't, to do some consulting and to learn more. I found myself here in Boise, Idaho, recruited for a position that really changed my life. And as of late, I'm at yet a new job. So it's been a very fulfilling and I would say a-traditional career. Most people get on the medical train at 15 and they get off at 65. I've gotten off and on that train many times, which has been risky and unsettling in some ways, but very fulfilling.
Well, and it's funny, like the perspective that you just said, where you look at healthcare as an industry. And I think a lot of us, I mean, we hear how much healthcare is a part of GDP and things like that, as far as, what the impact is. And certainly it's hard to ignore over the last 2 years, what the impact of our medical system, or, whether that be a payer, provider, a third party, a pharmaceutical company, whatever. But I've had a deep appreciation for the complexity of healthcare. The decisions that hospital administrators have to make, the decisions that you have to make that are not like for-profit companies when it comes to things like supply chain or service level, or the way that you manage, even getting paid, how long it takes to get paid as an organization. Like, were you infatuated by the idea of the human connection and the leadership through it, or the complexities of the business, or both? Like, maybe help me understand what gave you that appetite.
Healthcare is a business, no different to some extent, well, different and not different than manufacturing a car or making an iPhone, right? There's people issues, process issues, structure issues, technology issues, legal issues, innovation issues, human resources issues. There's a discipline, so there's a know-how, whether it's IT or legal or manufacturing. In this case, it's caring for people and human physiology to some extent, but it's really a complex industry. And I think what was most compelling is, look, at the end of the day, if we've learned nothing else in the last 2 years, what matters most is our health and that of those whom we care for or about. There's been an existential awakening, I think, for most of us, that shit gets real fast when you're not healthy, or your health or those whom you care about is threatened. And that's been profound. And it was, I felt that and sensed that early on. You can make a difference. You can make an impact. So part of it was personal. I used to watch that show MacGyver, and there's this one dude on an island with a switchblade and some rope, and I was like, gosh, if you could be like a doctor on an island, what would you want to be? And I chose emergency medicine because I felt like it was kind of cool. There was a sign when I was in med school on the door of the call room. So, emergency medicine, like a lot of, clinical specialties, you work strange hours, man, and it's tiring. And so there was a sign on the door that said the Marines of Medicine. And I liked what that represented, always there, first in, no fear, front line, bootstrapping it, dependable, reliable, gritty, scrappy, and capable. And so, part of the attraction was just the clinical impact that you can make as a human being. And in the ER, it's sometimes really quick. Save lives, be dramatic. And then I was like, man, this is a complex industry. It's unlike any other. So I felt, kind of using both sides of the brain, you could spend a life around doing this.
Yeah. I bet it's emergency medicine in particular. I had a consulting role, internal consulting role for a health system here for a couple of years. And I did a project or two in the emergency room, and we'd spend some time. We do a lot of time and motion studies. You're watching people go by, you're watching ambulances show up, and, teams get there. But in Boise, there's a steady flow. It was certain days, certain times. But when I went to Southern California, I spent the first night of the epic inpatient go live in the UCLA Medical Center emergency room. And, going to a whole new computer system, there's all these people sitting around, and it was nonstop. It was just madness. And I got an instant deep appreciation for the chaos of what's going on in an emergency room. And you've got to use technology. You got to make quick decisions. You got to move people in and out. There's people waiting. There's people bleeding. Like, why emergency medicine? It seems like Like, I know you're saying the first thing, you saw the kind of the Marines of medicine type thing. Like, did you just connect with that right away? Or like, do you like the chaos? Like, maybe
I mean,
talk about.
I think, yeah, you get it. Like there's, look, different archetypes, different personalities are attracted to different things. And, I was, an athletic, curious, interested, maybe mildly courageous. And I think for a couple reasons. Look, what a lot of people don't realize is the specialty that you decide as a physician is made under tremendous degree of uncertainty. You basically have one clinical year to figure out what you want to be when you grow up. And oh, by the way, you're not even exposed to everything. So a lot of it is just who you know. And what I found is that I liked the people. So the people that I interacted with, and that's why people take and leave jobs, right? It's for the people. So there was a fellowship that I liked. And, I would liken that maybe to not having been in the military, although my dad was in Vietnam. There's a fellowship that transpires there under those kinds of situations that I was attracted to. That's number one. I like the people. Number two, I like thinking broadly. The fact that, it's not a super micro specialty, but you get to know, this much about a lot. So you get to know a medium amount about a lot. And then the third thing was the ability to make impact quickly. You didn't have to sit and think for hours and hours and days and weeks and watch people, demise for weeks and months on end. You could fix something. And then the other side, candidly, was you can leave because I like my life. And I wanted to try to have some balance to be, like I said back in the beginning, more than just Dan the doctor. So those things were compelling, to me. Now the caveat is, over time, it's tiring, to your point. Like that frenzy can fry your nervous system over time.
Yeah. And I think that's kind of the sentiment that I was going for here was, it just seems like daunting for a 20, 30, 40-year career in that particular specialty. So then at what point in time then did you really start to scratch that leadership itch as a hospital administrator and then as a healthcare executive, which is kind of what you're out there doing today?
Yeah, no, I would say the embers were stoked when I was, out of college in that first job, when I saw doctors making dents in different ways other than at the bedside. So I was always curious about it. When I started, I was at Kaiser Permanente initially. And, I just sort of volunteered for some things, small committees, did some quality improvement work, tried to be effective. And then, fairly early on was asked to be the assistant chief of our department. And then a good friend of mine, a year or so into his role, basically over lunch one day said, I don't think I want to do this anymore, buddy. Yeah, have at it. And I was, in my mid 30s with one kid who was a year old in a new marriage, not what I expected. But, I found myself to some extent with this opportunity and, the department needed leadership. And once again, you just windows open, I tend to jump through them. Hopefully with soft landing, sometimes not so much. And again, by design and by default, I became the chairman of a very large department at a relatively young age and appreciated the impact to lead teams, to think systematically, to manage up, to manage down, to create business opportunities within the clinical organization. And I think that kind of began the snowball.
Well, it's hard to not reflect on how difficult the last 2 years have been for folks who are in a role of hospital administrator. I know that wasn't necessarily the role that you were in, but I know that you were advising and supporting, collaborating in that way. Like, I mean, maybe give us some perspectives, not just from a physician standpoint, but from a leader standpoint of what it's like to make decisions on behalf of a community from a healthcare perspective. I'd love for you to riff on this a little bit. I deeply value your opinion here.
Yeah, look, first of all, I don't think I think in general, like people go into healthcare with altruistic tendencies. It's not the most lucrative way, to earn a living, whether you're a clinician or not. It's a really long road for most. It's met with a lot of headwind. and it's a 24/7 operation. So I think, the good news is, I think, and there's a bell curve like there is in any industry, but I think most people in healthcare, clinical or not, are well-meaning. Like, they want to take care of people, right? The economics, the ROI just aren't there otherwise. There are a lot of decisions that are made under uncertainty, and the resource issues are very real. There just are fixed numbers of people. There's fixed numbers of space. There's fixed number of supplies, and you're catching smoke. You're moving at a moving target. And in the case of the pandemic, one you've never even seen before. And there's political forces and economic forces. It's freaking hard, man. It's just really hard. And you have clinicians sometimes fighting against administrators. There's a lot of stakeholders, and people's lives are at stake. So I guess the first I would say is, I think we all need to give each other some grace around this, particularly those that are in healthcare. Assume positive intent here. People really are trying to do the best that they can, and it's unbelievably hard. Having said that, there's nothing like a firefight to bring people together. So the flip side of that is you do see, heroics. See people working really hard. You see people leaning in. You see people getting creative, and you see, the fruits of that, in terms of vaccine deployment, in terms of how hospitals are shifting resources, in terms of how clinicians are working late hours, and non-clinical leaders are staying late too. So I guess those are my opening comments, and we can double click on them a little more if you'd like.
Yeah, I think the thing that I'm most interested in is just we live in a time that it's easy to get your hands on information. Now, the quality of information can be debated for sure, but there's a lot of self-diagnosis going on. We know this from Dr. Google, I think, as it's commonly called. And if you pair that, that research, that bro science research, which I think is helpful in a lot of ways, by the way. I think people discover things that work for them and fit into their lives through that means of research. So it's not completely an invalid way of navigating life, and at least at a non-emergent kind of triage, if you will, for like where you seek information from. It's probably perfectly acceptable to go try a bunch of different things in life. I do it all the time. But I think there becomes a certain point in time where we as a society start to look toward experts for clear information. And as you said, the information is not necessarily always clear. It's kind of conflicting. It's sort of confusing. We're doing the best that we can as it comes in. But a byproduct of that is an erosion of trust in those individuals. And when you pair it with a sensationalized media and echo chambers and news coverage that's meant for a specific demographic of people who are their watchers and listeners to amplify that echo chamber, like we end up in a pretty precarious situation about who to trust and who not to trust. How have you navigated stuff like that?
It's hard, man. I think the first is just to acknowledge that, look, wherever you live, at the end of the day, and whatever you believe, like, this has been a really stressful time. There's a lot of fear, there's a lot of worry, there's a lot of anxiety, and there's a lot of confusion. And so, again, the first way that I approach it is just to have a mindfulness and empathy around that when I'm dealing with others. Like, I think we all want the same thing at the end of the day, right? Like I said, we want to be healthy. Like, no one wants to get sick. Nobody wants someone that they care about, parent, spouse, sibling, child, to get sick. So, let's start there with some common ground and then move forward. But let's at least start there so that we have some fundamental common ground and shared purpose. Again, this is an unknown situation, right, to some extent. But the reality is it's not completely unknown from a scientific standpoint, right? We know about coronavirus. We've known about them since the 60s. We know about vaccine technology. The mRNA technology has been around since the 90s. So scientifically, there are some things that we can draw from that are what I would call evidence-based, right? I believe in the scientific method. You know what the scientific method is, right? There are ways of designing experiments and trials and studying things and proving them true or false. Is the hypothesis null or is it void? And so I adhere to that. That's my own belief. Other people may have their own beliefs, and that's fine too. At the end of the day, when there's a patient in front of me, my job is to get them better. And so I don't really care what they think about, other than, do you want to get better and can I help you? What I would say is, information is not necessarily data, and information is not necessarily fact. Information can be disinformation or misinformation. So I think trusting the source is really important. One of my colleagues likes to carry around a mug that says, your Google search does not equal my medical degree. And while perhaps a little arrogant, I think is based in fact. I agree that, look, if people are curious, that's awesome. Do some searching, but let's have some hubris and humility around it as well, and seek to understand. At the end of the day, buddy, look, trust is a choice. People can choose to trust others or not, and they can choose to believe what they want or not. I'm not here to convince people that the sky is blue or red. If you want to believe it's red, good on you. If you'd like me to talk to you about why it's blue, I'm happy to do that as well. So it's very complicated, Jake. I think at the end of the day, back to what I said about healthcare, we went into this to make people better.
Yeah.
And I still believe that to be true. I'll take it to the grave, right? We want people to feel better. And what we are recommending as clinicians is based in science, based in fact, with the intention of helping people feel better.
Yeah. How do you rationalize, and this is probably a pretty difficult question, how do you rationalize the fact that the pharmaceutical industry as a whole is a big machine? It's a big machine that I think in to your point, from an altruistic standpoint, they're trying to make medicines that improve the quality of life by and large, but there is a money-making aspect around some of it. And there are people who are certainly fearful that maybe certain decisions are being made or pushed, et cetera, that may not necessarily long-term be in the best interest or be completely necessary for where they're at in their life. And when they hear things like mandates and mandating certain aspects of health, that gives them heartburn, because they're saying, like, there's just not a compelling enough case for me to do that. Like, what's your high level viewpoint on your experience there?
It's really hard. So I guess the first thought that came to mind, I'll be honest, since we're just kind of riffing here, is the auto industry.
Yeah.
Another industry, right? Do we need cars that go 0 to 60 in 3 seconds?
Absolutely.
That,
2.2.
right? Like, it's right. There's an and conversely, like, do we need drugs that, like, get us high? Like, I don't know, maybe we do. Like there are incentives.
No, there are answers to that question, Dan. No, I'm kidding.
So, like, do we need seatbelts, right? Should we have to wear seatbelts? Like, is it safe to make a car that goes 0 to 60 and weighs, 2,500 pounds? I don't, like, is there, so I guess when I flip it to the pharmaceutical industry, right? If pharmaceutical companies are not making medications that are safe and effective, they're not going to be a business. No one is going to continue, I think, to either prescribe or utilize a medication that's not safe or effective. So that's a business decision, Jake, and that's a medical decision. And if those two aren't aligned, there is no pharmaceutical industry. We would not be living as long as we are now. People would not be living the quality of lives they live without medications for diabetes, for high blood pressure, for asthma, for heart failure, for innumerable conditions, for infections that people either died from or suffered with for decades before you and I were around, and even over the past 10, 20 years. So if you look at what's changed the lifespan and the quality of life of human history, medications are right up there, and so are vaccinations. My dad's uncle died of polio. It's not that long ago that people were dying of polio. That is named after him. So that's the medical piece, and that's maybe my riff on the manufacturing piece. In terms of mandates, look, I get it. We're an independent society. We have volition as human beings. We don't want to feel like victims. I get it. These are difficult decisions. At some point, I don't know, and I don't know the answer. It's just one man over here. How do you weigh out the good of society, the good of mass with the good of individuals? It's a tough decision. And again, I guess I would take it back to speed limits and seatbelts. It's fun to drive fast, dude. I love it. I have a fast car, right? And it's a pain in the butt to wear my seatbelt. But it's the law, so I wear it. I don't really want to get a ticket. I also want to mentor it for my son. And I don't want to kill anyone, so I slow down.
Yeah. No, that's a powerful perspective, fully aligned with this kind of what you're saying there. It's complicated. It's one of those things that if it was easy to solve, it'd be solved already. It involves a lot of variability of personal experiences and how deeply rooted you are in those experiences and how you make decisions, right? I mean, like if you don't trust the pharmaceutical industry and you didn't trust them before COVID, what's going to tip you over that? I think it's good communication. I think it's building bridges, kind of like what you're saying right now, is just like, hey, let's have some humility going into these types of conversations. Let's assume positive intent, like all good advice.
Like
Um,
here, the one of the things I would say from just a bedside perspective is, there's a saying in emergency medicine that trauma is not a random event, that accidents don't really just happen. There's a modicum of self-induced disease in our society, right? Trauma is basically, alcohol right? I drank and I drove, I drank and I fell down, I drank and I picked up my handgun, I drank and I went,
yeah,
right? Like, not just random. And same with disease, like heart attacks and obesity and diabetes, these things are not generally random. And the same to some extent is true with what we're seeing in COVID. It's generally certain archetypes, right? There are certain populations, right? Older people, sicker people, unvaccinated people are those that are getting sick. That's just a fact. And so people can make choices about how they want to live their life accordingly, but realize that those choices do impact others, because
yeah.
this is a transmissible disease.
And then applying that same logic, there's an argument to be made around diet and exercise and those types of things. Like you can't mandate those aspects of health, food choices, how ambulatory somebody is on a regular basis, or fitness goals. And maybe we'll live in a society 50 years from now where you're like, hey, your social credit score is going to go down unless you go walk 3 miles. But like right now, we're not regulating those things. So I think that there's a strong, at least, weariness or frustration with how new it is to exclude folks from society based on a personal choice.
Unless that personal choice affects the health of others. And what I guess I would say is, and I don't want to get an arm wrestle with you because you'll kick my ass, but if someone is obese, other than sitting next to me on an airplane, it doesn't really directly affect my health or my family's health. Someone who's unvaccinated, it may. So I guess that's the caveat. And the basic, and this is kind of what you're seeing with the variants. We haven't even gotten into it, right? Variants are, viruses, they're biologic entities. They require mediums in which to replicate. And those mediums, at least as far as the pandemic goes, are human cells, right? They got to get into our body and they got to replicate. And they do it better in native environments that don't have antibodies floating around,
Yeah.
B cells and T cells that are primed. And so they're going to go to unvaccinated populations. They're going to replicate, and that's just going to continue. So, as a society, we just got to decide how we want to deal with this.
Mm. Yeah, I saw switching gears out of the people to replicate that, like deer and like other mammals can get COVID. Now, I don't know if that means that like they have the same exact symptoms, but they can carry it. Apparently, I don't know if that's true or not. It could be fake news, but the more things to worry about. So, what do you do now in your current role? I mean, you're the chief medical officer of clinical solutions there for Matrix Medical. What's that meant for you during COVID?
Yeah, it's cool. So it definitely was not what I signed up for. I think, like so many of us over the last 2 years, what we're doing now has been different. Regardless of your industry, right? I mean, so many industries have been affected. So many jobs have been affected, for better and not necessarily for the better. For me, I joined an organization that had really one line of business, which was a home-based delivery business. And it's not really good to be in a home-based business when in the face of the pandemic, when you got to go into people's homes, right? Not a great business model. So yeah. We saw an opportunity to take clinicians. Matrix has a lot of clinicians, and we have mobile health assets and so forth, and to help essential industries, those that are in distribution of goods and primarily food that we all rely on, that could not stop in the face of the pandemic, and bring clinical services to them to keep them healthy and productive. So we deployed clinicians, we deployed testing early on, we're deploying vaccine and even monoclonal antibody treatments now. across the country, particularly to essential industries and hard to reach communities, so both public and private, try to keep people healthy and productive. So, we've helped support many Fortune 50 companies and many states and communities that did not have access to care, and also were essential for really the health and the sustainment of our society. Food. So we had a lot of impact in the food chain by keeping people that were involved in food manufacturing and distribution healthy.
And so, how is this going to change how does COVID fundamentally change or shift the employer-employee relationship in the confines of health? Has it? Will it?
Yeah, it's a great question. Yeah. I said it earlier, I think this has been a bit of an existential awakening for us as individuals. And what I would say in the corporate sector is what it's done is elevated the role, the meaning and the value of a healthy workforce. I think employers, boards, and leaders realize that if my people aren't healthy, I have no business.
Yeah.
Regardless of, fundamentally, if your workforce is not healthy, cannot come to work, you have no business continuity, therefore you have no productivity. So, and this extends way beyond, well-being programs. Now I think there's going to be a doubling down really in terms of, holy cow, not only in the face of the pandemic, but in general, I need a healthy workforce. A healthy workforce is good for my business. And I think what we used to see, Jake, and you're pretty familiar with this, is you have health benefits. We've got an EAP. We'll give you a free gym membership. Go be healthy. It's kind of out there. And I think what the pandemic has done is brought it in here as a true business imperative and a strategic priority.
And so trend likely to continue then as far as employers investing in an employee's health and trying to create at least an ecosystem around them so that they can get access to gyms, access to alternative treatments, et cetera, et cetera. Like they're more involved in keeping people healthy.
I think so. And I think it's also more of a push for employees, right? I think it's on both sides of the coin. I think people are saying, wait a minute, if you're going to recruit and retain me, I need a healthy work environment. And maybe that's working at home, right? Maybe it's access to care. Maybe it's on-site services, right? Maybe I'm in a rural area where I don't have access to services. I need you to have those services there, not only for myself, but for my family. So it's a recruitment and retention issue. And I think it's both a push and a pull. It has to be a pull from the employers. And I think it's going to be a push from the employees, right? Because again, health, we all realize individually that health really matters most to us too. So I think it's on both sides of the coin. And therefore, I do think it will be sustained, at least moving forward for the foreseeable future.
Yeah. The other thing here too is there have been, I guess, elective procedures, or at least like non-emergent type procedures that had been put on hold for long periods of time as a result of COVID. Do you have a perspective on the impacts of what that has been, either on the workforce or across the country? And is there a point in time which we can expect some kind of normalization, in your opinion, or is it going to be a while out?
So first of all, what I would say is it sucks. Like in general, nobody really wants to have a procedure. So when we say elective, we generally mean procedures, or in this case, I think you meant surgeries, right? Operations, that are not acutely life or limb threatening. But if you can't walk because you've got a terribly arthritic knee, or hip, or back, or you need a bypass and you can't get up your stairs anymore and you've been sleeping on your couch for a month, like that may be elective, right? But it is massively impacting people's quality of life. And then there's downstream effects, right? Now I'm getting deconditioned, I'm getting out of shape, I'm getting depressed, I don't want to take my medicines anymore. So other than perhaps some cosmetic procedures, right, most procedures are not elective. And that is to say, you need to have them, they're just not emergent. So I would say from a quality of life standpoint, this is affecting, hundreds and thousands, if not millions of people across the country, aunts, uncles, cousins, friends, grandparents, and even kids, right? Kids that need limb lengthening procedures, or, sometimes even transplants I would call urgent, but not necessarily emergent, right? So it's massively affecting people. And I guess what I would say, Jake, is that, because we've had so much hospital capacity has been dedicated to COVID, right? From a system standpoint, from a humanity standpoint, it affects that individual's ability to get those downstream procedures. So when we think about what we need to do as a society vis-a-vis mandates, right, the M word, again, it's just another systemic factor. The other reality is that from an economic standpoint, right, clinicians and systems are not doing procedures which generally are accretive. And they're switching to care that is not typically as financially viable. And that also affects all of us. If physicians, clinicians, and healthcare systems are in financial trouble, our access to those services can be affected.
Well said. And then there's another thing I wanted to ask you about. It's so funny how fast these podcasts go. Like I can sit here and talk for hours. But one of the main reasons I asked you to come on, so it'd be a disservice if I didn't ask you this question. Whenever I find people like yourself who are, in my opinion, very clear-headed, you know how to detach kind of the emotion from the facts or the reality. You've worked in high stress environments and you're accustomed to making big leadership decisions. I think there's a lot to learn from folks like that. It's why I ask folks like you onto the podcast. When it comes to the times that we're in, just reflecting broadly, big T time, people, I find, many of them are not dealing with stress very well, or not finding themselves emotional resilient very well. What do you do in order to get yourself in a state? And you seem, every time I talk to you, man, you're so consistent. You're so like uplifting. You're such a positive influence in my life. So like, how do you get into that state?
Gray hair, no hair.
Gray hair.
Yeah, look, to some extent it's a choice. So, how we behave, I think, is a factor of intention, right, which is insight. So how do I want to behave, and courage, right, making a mindful decision. So ideally, people can take. I always say, before you go to a code, and a code is when a patient is sort of dying, right? What's the first thing you do? And the first thing you need to do is take your own pulse. So what I would suggest for my brothers and sisters out there is to take your own pulse. Take a minute to check in with yourself, how you are feeling and how you are behaving. How we behave is a factor of what we think, what we know, and how we feel. So the better are we able to get clear in what we think and how we feel, the more intention we can have with directing our behavior. So I guess those are some initial thoughts. It's also a choice. Look, it's a choice to be a victim and it's a choice to have volition. We can choose that. The other thing I'll get back to is just, look, I think we all need to have some grace with each other and some empathy. We're all in this together. If we haven't learned anything, is that this pandemic, we're all in it together, whether we want to be or not. No one wants to get sick. We all have families. We all have people whom we love and who ideally love us. So again, let's show some grace for each other around that. And I think, again, if nothing else, this pandemic has shown us really what matters most. And it should be a clarion call for all of us to take care of our health and the health of those we care about. That at the end of the day, it's not things, it's not stuff, it's not accumulation, it's not body archetype, it's not fast cars, much as you and I love them, right? At the end of the day, man, it's being healthy. Like, you don't got that, you don't got nothing. So it's pretty humbling.
You, I take it this time of year, finding time to spend with family, friends, all that kind of stuff. Is that opened up for you a little bit?
I try to, like I said, it's no one's getting younger, so I was able to spend some time with folks and child over the last couple of days. But there's no rest for the weary. So emergency physicians and clinical entities keep on rolling. So my team is out there, if I'm not, 24/7. I try to support them. But I think, one of the things we have to learn is we can't take care of others. We don't take care of ourselves.
And
And so,
you're actively practicing medicine now too, right? I mean, are you taking a couple days a week or a couple days a month here and there?
yeah, I do a few shifts a month. I'm a board certified emergency physician. And I think from a credibility standpoint and also from a connecting to purpose standpoint, it's actually really nice to take care of patients. Dare I say, in some ways, it's easier. I've been doing it for a long time, and it really it's a good level set, And when you can make a difference and people say thank you, it provides some tailwind to your life.
Well, my friend, so honored to have you on the podcast. Love your perspective, your experience, just a wealth of knowledge. So I'm glad I get to share you with my listeners as well, my friend. So looking forward to having you on the podcast again. I'd love to continue and riff on these sorts of conversations. And you take care, man. Have a great week.
Thanks, Jake. Pleasure, buddy. Appreciate it.
All right, cheers.